I found as a general pediatrician that I could not provide this level of communication, this level of support that we are able to outside of that 15-minute examination window. And so that was my purpose. I wanted to be able to help the world in a more meaningful way, in a deeper way, in a way that would allow generations to come to benefit. We have to be a little bit meta about it. We have to remove ourselves from our body and then step back and take a look at everything and really dig into what's working, what's not working, where we could use help, who we can get that help from, what limiting beliefs we have to upturn in order to help ourselves, and bringing that all together in a way that's not horribly overwhelming. There are so many things that we can change. Are we ready for it? If we're not ready for that change, how do we support ourselves?
With us today is Dr. Santisree Tanikella, a board-certified pediatrician with over 15 years of experience caring for children and families. In our conversation today, we explore her integrative approach to healing and a perspective on how to systemically improve your experience of life, whether you're a healthcare professional or a stay-at-home parent. Her insights are both refreshing and empowering. Let's go.
I am a practicing general pediatrician. I also practice integrative medicine, and the marriage of these two in my clinical practice has been a beautiful journey and sometimes a painful journey. So what I essentially do is I bring holistic medicine to conventional medicine, and this allows me to offer the best of Western and Eastern medicine in a evidence-based, patient-centered manner. So I take great pride in what I do, and I feel like my patients and the parents that I serve have really benefited a great deal. In fact, they have said so many wonderful things about my work that I've then launched a program outside of that. I created what's called Integrative Approaches to Mastering Wellness. It's my own personal company in which I offer coaching services and mind-body modalities, really to extend what I'm able to provide the world, really, because in the exam room, I can only serve one family or one person at a time. But through this business, I'm able to talk to people virtually. I'm able to talk to people across the nation, across the world. And I have a podcast that also allows me to connect to people whenever they're available on their time. So again, something I take great pride in. I feel like it's been an amazing service. I have learned so much in the process of this evolution over the past, 20, 25 years. So here's what it looks like. And what I want to bring up is the term alternative medicine. Sometimes that sounds very divisive. And what I'm going to say to counter that is that in my world, I don't practice alternative medicine. I practice what's called integrative medicine. So we're bringing things together. It's not this or that, it's this and that. And it allows for people to get the whole gamut of services, both in the traditional allopathic osteopathic world, as well as in practices from indigenous forms of medicine, whether it's Ayurveda, which is the ancient Indian form of medicine, or traditional Chinese medicine, even massage, chiropractic medicine, you name it. So what does that look like? Let's say I have a child, and I'm going to use a very basic example, right? Let's say I have a child who comes in for a cold and he's 4 years old. Well, let's be honest. Most of the time, colds are viral. We don't give antibiotics for that. And the conventional wisdom that's often given is fluids, rest, on all Motrin if you have a fever, maybe a humidifier, but that's basically it, right? When you add in integrative medicine practices, we're thinking of, can we do a nasal lavage like a neti pot? Maybe not so much in a 4-year-old, but you certainly could do that in a teenager or an adult. Can we use honey? There are studies showing that honey can be very efficacious for cough. So how are we packaging this up for our families in a way that helps give them lots of resources in the time that we're allotted for their visit? I'm going to admit it's a little bit hard to cram all that goodness into one small visit. But let's take a bigger example. Let's say I have a 13-year-old coming in with anxiety. That is actually becoming more and more common year by year that I've been in my practice. And I've been practicing pediatrics since 2012. So that's when I graduated from residency and became a full-fledged physician. Now, anxiety in a 13-year-old, well, I have a lot of parents who are reticent to starting their kids on medication for that. And they're not wrong for feeling a little hesitant. There's a lot of information out there. There are a lot of emotions about psychology and needing a therapist. There's a lot of stigma surrounding that. So in this case, education is really key. Listening is even more key. So you really have to dig in and understand why a child, why a teen might be feeling anxious about something. And oftentimes it can be situational. That also means that sometimes it can be corrected without ever having to see a psychologist or without ever having to take medications. If we're never able to take the time to listen to the story behind it, then we're missing the boat entirely. So that's one piece of integrative medicine that I really love. It's the attention, it's the individualization of medicine, it's the tailoring of therapies.
So speaking of someone who struggled with anxiety myself, you mentioned maybe not necessarily needing a therapeutic intervention, and you mentioned earlier about not immediately jumping to medication. So what's the third option that you might head them down? Is it more nutritional approach? What would the third option be that you would suggest?
Oh gosh, there's a lot of options. And I'm going to put this out there. It's not just one option. Sometimes you have to take many different interventions and bring them together, hence integrative, right? So when people think anxiety, they're not necessarily thinking food and diet. However, there is some data out there that shows that junky food leads to junky outcomes, right? That perhaps there is a role for what our gut flora looks like, and our gut flora grows or diminishes based on the food that we're eating. So when you think of the GI tract, it's one of the number one places where we're creating serotonin. So if we're not able to create serotonin from the GI tract, then where are we getting it from, right? We get it from our brain. But there's a natural way to create this. It doesn't have to be the SSRI, the medications that are helping us to keep the serotonin that we have. So diet is part of it. Sleep is huge, huge. I can't tell you how many teenagers do not get enough sleep and think that that's normal and cool. And I'll be very, very perfectly honest, I was one of those teenagers. I never got enough sleep, and I didn't think that there was anything wrong with that. My mom was a shift worker and also never got enough sleep. And I grew up with, me, my mother, my brother, we're all night owls. We do our best work at night. And so it's a very interesting sort of thing to see how that's impacted me as I've gotten older, that perhaps if I got a little extra sleep, my focus would be better, my attention would be better, the conversations I'd have would be better, my retention of information would be better, right? There's so many pieces to this. So why are some kids anxious? Because they feel like they can't focus or attend to their schoolwork. And then maybe they're afraid of getting a bad grade, and that gets in their head. And then they're not able to sleep at night. Do you see the cycle here? Like one thing leads to another. So being cognizant of what our needs are when it comes to sleep, making sure that we're getting restful, sound sleep. A common question that I ask my patients, even during their well visits, is, do you snore? Or does anybody in the household tell you that you snore? Because if they do, and they're possibly might be having apneic episodes, those moments in time where you pause in your breathing at night, well, that might mean that we're not getting the restful sleep that we thought we were getting. Perhaps that person actually could get some help from getting a sleep study. So that's one part of the puzzle. So we've talked about nutrition, sleep, exercise. Exercise is great for mood. Most of our teenagers are not getting enough exercise unless they're involved in team sports literally all year round. And then there's the kickback of that, which is if they're in team sports all year round. Well, unfortunately, some team sports are very time consuming. So that can impact their schoolwork. So having a healthy balance of activity is really important.
And speaking of integrated systems, we have an integrated body, requires an integrative medicine. And my background, I have a bachelor's in urban planning. And what goes into that as well is the resources, how the cities are designed. If someone has to get in their car in order to go to the grocery store or to the park, or whether they're able to just walk a half mile to do that, and what does that walk look like? Is it actually pleasant to do, or do you have to sidestep garbage and dodge traffic in order to get to there? No one's going to do that unless they have to. And so it's an integrated system. It sounds like my background with urban planning and yours with the more nuanced integrative medicine, the whole thing needs to come together.
Yeah. And urban planning, that's like incredibly important because part of this is also community. Right now, we're in this epidemic of loneliness, and yet everybody's online. So, how are we online and in social media and yet feeling incredibly lonely inside, where everything looks great on paper, but doesn't feel like that internally? So, really focusing on that piece. Are we having connection to our environments, connection to other people, connection to our family, our school systems? Is that connection serving us? Is it helping us? Is it making us or allowing us to feel like we're part of something bigger? That is, I feel like the heart of urban planning is creating these centers where people can go as a community. It's the ergonomics of it and the ease, but also, if you're walking outside, you might just see a neighbor who's walking their dog, or, you're going to run into people. But if you never leave your house and you online order and they deliver because you feel like it's too dangerous to go outside, do you see where we self-isolate here? And then of course you're going to feel lonely and anxious.
And I feel like there's a bit of a balance because in my background, there was a huge focus on ecological sustainability in urban planning. And it may just be where we are in history, but what I didn't see a lot of is focus on how do you build a city so that people are not just ecologically sustainable, but psychologically sustainable. How are
Mm.
they able to be well in a way that the infrastructure supports that this is the easy choice. I've been practicing this in my own home where I've been learning how to build systems to support the right choices, value-based choices or wellness-based choices. And I was watching a podcast a little while ago, and I don't remember the name, but I want to note that this was not from me. They said that if discipline is hard, you're doing it wrong. And that was notable to me because I've been doing discipline wrong my whole life, apparently. They talked about building systems that support your choices in the right direction. And so I've been doing that with my family, and we had a weight room and we had a TV room, but we only did one thing in either of those things. And if you wanted to do either of those, you became kind of isolated because the TV room's off there, the weight room's over there. And so one of the things that I did was I brought those two rooms together, and now I took the couches away to that they're not centered on the TV. The weight room is centered on the TV. So you can still, if you have to, go sit on the couch. But the easier choice is to get on the treadmill while your favorite show is on. And the other part of that as well is that I'm able to go down with my wife and my child, and we all have family workout nights while we're watching our favorite TV show, that sort of thing. And it's like the infrastructure supports better decisions. It's not something that you have to fight in order to do that. And you can build urban planning. You can do urban planning in a way that supports that. And what I would like to get back to is your experience in integrative medicine. I feel like there's a way to build the system, build the culture in a way that supports those type of decisions too. What are your thoughts on that?
Yeah, exactly. Absolutely. We have to create this structure in order to really, we thrive on structure. We also thrive on community and each other. So, when you have one person who has that structure and one person who maybe could use a little bit of help, that in and of itself, just being able to learn by example can be huge. The same goes for the school system. If the school system is supporting physical activity, is supporting mental and emotional health, is supporting good nutrition, right? Our kids spend a lot of time at school. So if they're getting those supports within the school system, how amazing is that? It's not always enough. And I say this knowing the weight of what I'm saying. The school breakfast programs for families who cannot afford to have breakfast. Amazing programming, very necessary. However, I have families where their kids will eat breakfast at home and then eat breakfast a second time at school, and they love food, and so they will. But also, sometimes the school breakfast and the home breakfast may not be the healthiest, right? May have high sugar or high carb content and be lacking in the protein and the fruits and vegetables. So, how do we ameliorate that? How do we mitigate some of that? It's knowing what the school is offering so that we know what to give or not give our child in the morning. But also, how do we promote the school? Do we need to promote them financially? Right, like it goes so much deeper than that too, right? It's government, it's policy. So many things are involved here. But all to say, this is one just little tidbit of how infrastructure can help us to thrive, but also the wrong infrastructure can hold us down.
And I love how you noted the program in and of itself is good. It has good intentions. It helps people, but then there's it might need to be adjusted, or let's bring some other things to balance it in. And I'd love to dig into that a bit more, especially with you, because you have some really unique experience that I think would be amazing to bring to bear upon this problem, which is the disintegrated society and support systems and medical systems that we have. You are pediatrician and integrative medicine practitioner, also a coach of families and helping people work together, helping their kids, helping their individuals or their marriages work together to be able to kind of live at a higher level. So you have a really kind of unique perspective in this, where when you are having to work with the families and the kids, and you mentioned with the schools and all these different systems, do you find yourself having to be the one to do all the legwork to make that happen? Or are there systems in place to make that happen? Or what is that experience like for you as someone who's intentionally trying to do this thing, to integrate all these things together, but you're operating in the way things are right now? What is that experience for you?
That's a loaded question, but a really good question. So, circling back to that example of the teenager who has anxiety, because we'll just continue with that. I think it's a really good example to help solidify information. So, in this case, right, like I've gone through all of the things that are modifiable, right? Lifestyle modification with nutrition, sleep, exercise, community. But another piece that I didn't talk about was stress reduction. So, how do we reduce stress? And where do we find the balance, right? Because some people need that little bit of fire underneath them to get moving, right? That's good stress. But too much good stress can end up being a bad thing, right? Sometimes we end up in overdrive, overwhelm, exhaustion, and then we burn out. And for some people, that might be very paralyzing for them. So recognizing where we need to reduce stress, or maybe reduce the number of activities that we're doing so that we can focus, is helpful. When it comes to really helping a patient, you mentioned integrative, right? It can't just center on me. It also centers on the people that are around. So there's your psychologist who can provide therapy, the psychiatrist who can talk about medication, risks, benefits, side effects, and may need to tweak here and there. There's the community at large. Maybe they're just in the wrong community. Maybe it's a toxic situation that they live in. Maybe there's child abuse. Maybe, right? Like, we have to think big picture here. So do I find myself doing all the legwork? No, absolutely not. I do very much lean on the people in my community, in the medical community, and within the school system to be able to help a child really thrive. So let's say it's a child with anxiety or even a child with ADHD. Do they need an IEP, an individualized education plan, where there can be certain accommodations put into place to assist with learning? Do they need to be evaluated for that at school? Yeah. So let me give the family resources on how to get this done and how to communicate that request to the school, so that within a few months, maybe something like that can be put into place so that the child can learn better, which will then help boost self-esteem and self-efficacy, because now they're learning ways to help themselves. And that's not lost, right? Those are systems that we start to build internally as we get older and older, and into the workforce. So no, it's not a job that I do on my own. Do I find that sometimes there is difficulty in access to care? Yeah. Sometimes I do find it can take a long time to book an appointment with a psychologist in our area. Sometimes it can be difficult to book with a psychiatrist. Sometimes there are some psychiatrists that only offer virtual care, and not every child or parent wants virtual care. Sometimes they want to be seen in person. So it really depends on the family, their needs, their abilities, access to care, distance, right? All of these factors that kind of play a role in what I'm able to offer and what I have to be able to hand off to other experts.
So do you have kind of a running list of other professionals that you've worked with? Like, you built a network that you're able to kind of lean on, like you mentioned, to refer people to other psychiatrists and psychologists and all of that. Have you built that network for yourself?
Yes, absolutely. In my clinical practice, I have a printed packet of information for my patients to take home.
It sounds like you built that network over time due to your own professional experience.
And I've had amazing colleagues who do what I do, right? family practitioners, pediatricians who have helped add to that list. I mean, when I came into my current job, my current clinical position, that list was already created and now I've just added to it. There's also a piece on informational resources. So I talked about resources that are evergreen or resources that are available at the convenience of the family. So one resource that I give freely is for those families who have Netflix. There is the Headspace Guide to Meditation. It's a series and it's amazing for people to listen to because it, to me, essentially is a primer on mindfulness-based stress reduction. There's the Headspace Guide to Sleep as well, which is great for people who might have trouble falling asleep and staying asleep. I find a lot of people have very, very busy minds at night and have trouble settling their minds. I have found that to be a wonderful resource. There's any number of applications now on our phones too. Insight Timer is one of them. The Calm app, right? Teaching us mindfulness, meditation, really truly trying to help with stress reduction. Now the coaching piece. So I'll say this too is I've learned meditation and mindfulness, some guided imagery, hypnosis, biofeedback. I bring these elements into the clinic setting as well. So for an integrative medicine visit, if a family is seeking out mind body modalities, I can offer some of this and I can tailor it to the patient, which is great. So sometimes they'll come in, we'll do a meditation together, and I'll actually have them record it on their phone so that they can take it home with them. That way, they have it whenever they need it. But in lieu of that, having all these additional resources and being able to find what you like and dislike is paramount. Sometimes you don't always need a pill to be able to go to sleep. Sometimes we just need to learn how to settle the mind. And the more we do it, the better we get at it. It's like the ABCs, right? Like none of us managed to learn the ABCs within 2 tries as a toddler. Like, I mean, if you did, bravo, but I was not that person. So you have to develop that neural track from repetition and practice and repetition. We mess up, we get back on, we do it again and again and again. And then it becomes something that we can then use and rely on in a pinch, right? That same skill of winding the mind down to go to sleep is a skill that you can use before public speaking. It's a skill that you can use before tests. It's a skill that you can use when you're asking for your partner's hand in marriage, whatever it is, right? Whatever stressor it is that you're coming across, it's a transferable skill. It's not medication based. You can use it whenever you want. No one will know that you're using it. There's no shame. There's no stigma. I mean, it's amazing what mind-body modalities can do. The one piece that I ran into was this is I've had children and teenagers who've done great with it, or maybe it wasn't their speed. There are some patients that I've had that are like, meditation's not my thing. I'm like, have we really tried exhausting it? But you know what? I'll take you for your word. I'm not going to force you to meditate with me. But let's then talk about the issue that you're having. Coaching has been the thing that has really helped a lot with that. And it partially stems from a cognitive behavioral therapy model where we're looking at what's happened in a factual sort of way, what our thoughts are on that, what our emotions are as they come up, and how we react due to our emotions. And was that course of action the best course of action that we could have taken? Or is there an alternative course of action we could have taken that would have allowed us to have better outcomes?
So taking a bit of a systems-minded approach for inputs and outputs to
Precisely.
understand what's going on in the situation and then what resulted. What can we tweak?
Yep, exactly. And I think the empowering piece here is many of us have thoughts or opinions that we think are facts and are not facts. And then we base our whole course of action based on a non-truth. We don't even mean to do it, but it happens, right? So as an example, one of my patients said, well, my classmate put his book bag there because he wanted me to trip on it. And I'm like, is that actually true? Yeah, it's true. Are you sure? It's absolutely true. Could it be possible that he was excited about something and started talking to a friend and then dropped his book bag there and it was fairly innocent? And then there's this pause. Yeah, that could be true. Okay. Could it be that he really truly was malicious? Maybe, but probably not. Okay. All right. So the fact is he dropped his book bag there, period. Did you see it? Yes, I saw it. Could you have walked around it? Yes, I could have walked around it. So did you ever trip? No. Okay. But you're still mad. Yeah, I'm mad. We've established that there's a possibility that he didn't really mean anything mean by it, that he was just being him. And have you ever done that to somebody else? Is it possible that you could have accidentally put something obstructive in the way of somebody else's walking path? Yeah. Okay. Can we forgive this person? Yeah, we can forgive this person. And then we can move on.
Helping
But
people. We'll get back to that conversation in just a minute, but I have a quick question for you. Do you know anyone who is working to improve other people's lives, but perhaps aren't getting the credit or the recognition that they deserve? Reach out to me and I would love to feature them on this podcast. Thanks. If you've been enjoying this podcast, you might be interested to know about some other resources that we've been developing. Search Bennett'sCompanies.com and you will find books, podcasts, and other resources that we've been developing to help you live a happier, healthier, and more fulfilling life. All right, let's get back to it. To rewrite the narrative
yeah.
and understand what's going on in their life in a way that actually empowers them to have peace and the capacity to have a voice in their own life. I love it's incredibly important, and I think it's still a developing skill as far as broadly in the public sphere. You don't see it a lot unless you start looking in more specialized areas, whether it be maybe philosophy or psychology, that sort of thing, where people start having kind of a meta-analysis of their own brain. But I wanted to go back a little bit to what you mentioned earlier with the collaboration with the other professionals that you bring to bear for your clients. And I wanted to come to it with kind of two different approaches. One from a up and coming professional in the wellness space or the health and wellness space, and the other from the side of the patients of that for the professional, how do they begin to build their own roster? What are the types of other professionals that they should look at? And let's assume this person is an up and coming pediatrician. What type of relationships should they build with other professionals? Who should they look at? Who should they network with in order to start building their roster to be able to be more effective for their clients?
So I was lucky to go to a residency program where I had a lot of really amazing attendings, really good people, good-hearted, kind people who wanted what was best for their patients. So you know what? The people who train you know a lot. So to the new physician or new healthcare provider, use the people around you, use your teachers and mentors as your number one resources. Find out what their resources are. They may have a roster already. And if you have even just an inkling of a moment to go over who does what their strengths are, what their weaknesses are with that mentor, that's a great way to, start. Now, when I went to residency, graduated, when I graduated from residency, I moved to a completely different state. Back then in 2012, most things were in person. So it didn't really make sense for my patients in New Jersey to cross over to New York City for their practitioners. Once again, when I became employed, I counted on my very first boss to help me find who my referral base was going to be. So whether that's a GI doc, pulmonology, allergy, therapy, psychiatry, you name it, she was able to kind of help me identify who those people were in our community. But let's say you're going into solo practice in a completely new place. The best way to learn is by experience and by networking. So go in person. If you Google somebody and you're like, that person seems interesting, let me meet them. Set up short, even 15-minute encounter with them so that you can get to know them a little bit better, what their mannerisms are like, their communication style, what kind of patients they see, what kind of patients they don't see. And this is where you begin your roster. And it doesn't have to be a fast process. I will be the first to say sometimes this process can take months, years, and that is okay. You know what you know now, and in a year, you'll know so much more. And 10 years after that, you will know so much more. And in this ever-growing society, there is so much information online that you can also find educational resources for your patients there.
And even resources like where you and I met, which was a conference on integrative
Mhm.
medicine, which is the Academy of Integrated Health and Medicine, I believe it was the AIM
Mhm.
conference. And that's another great place because it's literally you walk around with a name tag that says your specialty and you meet people and get to know them a little bit more and just start building your roster and figuring out who would be a good person you would like to work with, who has the demeanor that you're looking for different clients and all of that. And so I would like to maybe kind of zero in a little bit more for on the patient side. Now, we talked about the professional where they have a couple different resources professionally to go look into, and they might even be able, depending on their pay structure or whatever, might be able to have their company pay to send them to conferences and network and all that, depending
Yeah.
on where they work. But on the patient side, they don't have a lot of those resources. Most of the time, all they have are Google and then their local person, or maybe they have a primary care provider, and they can go ask that person who might be who might be good to look into. And I have a couple different examples. I feel like this would be a little bit of like a case study type of thing. If you had someone who you were advising who just struggles with anxiety, what type of roster might you help them build of professionals that they should go check out to
Yes.
handle all the different systems?
So the first would be talking to a primary care provider. So if they have a very good relationship with their PCP, whether it's a pediatrician, family practice, internal medicine, that would be their first resource or amongst their first resources. With mental health and behavioral health, generally speaking, on the back of the insurance card, if they have insurance, there is a phone number to call for mental and behavioral health. So you can find people who are in network. Now, not everybody wants to go in network. That's okay. There are also psychologists who are out of network or self pay, and those are resources that you might have to find online or by talking to family, friends, or even support groups that you've found online. So that would be another place to look is insurance or online. I have found too, if there are testimonials online, it's helpful to kind of see what a practitioner is capable of, where their real wheelhouse is based on the reflections from the testimonials. Now, of course, do people always post the negative commentary on their websites? Probably not. So it might be a little biased. So I would keep that in mind when looking at it to take some of these testimonials with a grain of salt. That,
Awesome. And those are some great places to
yeah.
start looking for kind of here's some generalized areas for help. And then where would someone, just for a layperson who doesn't know much about anxiety, they just know that they're suffering and they want to do something about it. What are some of the different areas that they might look for a professional? You mentioned earlier nutrition might be helpful. What
Mhm.
are some different, so obviously there would be a nutritionist, and then what are some other areas that they might need to look into to start getting a more holistic picture on anxiety treatment?
So I think if there, and this circles back to the beginning of the conversation, if there's a situational component to it, that's really important. So if you feel fine at home, but the thought of going to school stresses you out, what is it about school that is so stressful, right? Is it the people that are on the bus on your way in or your way out, and then you're fine during the school day? Well, that's pretty identifiable then. There must be a specific person or number of people on that bus that are perhaps bothering you or that you have a negative relationship with. So that would be one piece. If it's you're fine at home, I'm sorry, if you're fine at school, but not so great at home, what's happening in your home environment that life is feeling a little sour? So, yeah, is it, we have to figure out what the environment is. And then I think if we have a fairly good idea, finding the help that you need becomes a little bit easier because now we have some direction to go in.
And I think
Uh,
you could also do that sort of kind of situational analysis also over your own timeline, going back. Is there a particular age that comes to mind when you think about being anxious? Or is there a particular time in your history that when you think about that, you get anxious? That's
mhm.
kind of, you can go either way with that. There's a exercise that I often do with my wife, and she does it with me when it comes to either traumatized parts or parts that have like alters or different parts of our own psyche that have maybe gone through stuff, and that's a little bit of a different conversation on the back end of that. But one of the things that we'll do is we'll simply ask when someone is experiencing these heightened emotions and there's no really pinpointable place in their current life, simply ask, how old are you? And
Hmm.
often there's a number that comes to mind. And say, for example, 7 comes to mind. Like, what was happening when you were 7? And then these memories often start coming. And then people will start like, well, my parents got divorced when I was 7, or I got into this accident where my dog died, or some situation, some events was happening around that time. And then you can begin to help that person integrate that part into their adult narrative where, yes, that happened, but then here's what happened after that. Here's what happened after that. And then you grew up and you became an adult who is able to handle situations like that or something like that, where you kind of, you're able to a little bit pinpoint where they're going, and then you can kind of help them walk forward to where they are currently. And obviously there are professionals who are trained in this, but there are also some like resources as well to be able to learn to do that for yourself or for the people around you. But that's another example of just situational analysis, but over time.
That is an amazing example. I fully agree. Yeah. When we look back at our past to understand where the roots of some of our emotions come from or triggers, maybe that might be a good word too to use in this instance. There are so many things that we can go back and do. So even as an adult, I can go back to my childlike self, and again, I do this with guided imagery where we provide solace and wisdom to that child.
In a sense, reparent your own child
Yeah.
self.
Yeah.
Be the
Exactly.
parent, be the parent that that part of you needed.
Exactly. Exactly. I could think of a version of myself that, gosh, if anybody proved me wrong, I would get so upset or embarrassed to the point where, in school, like I didn't want to answer questions because I didn't want to be wrong. I didn't want to be wrong. So perhaps I didn't raise my hand as often as I could have or should have, or right, like there are these little examples all through my life. When it comes to having created my own podcast, it was this. I had to face, well, what if people think that I'm stupid? What if people think that this was a bad idea? What if I'm wrong? What if the data doesn't support that? Well, you know what? Here we are. And if the bigger goal is to help people, then can I overcome these pieces of me that were so easily triggered when I was younger? And is that reality true anymore? Was it ever a reality? No, it probably wasn't a reality. However, somewhere along the way in my childhood or early adolescence, I equated intelligence with lovability. So if I was intelligent, that I'd be more lovable for that. If I was fast, I'd be more lovable. If I was creative, I'd be more lovable. You could any number of adjectives that would equate to love. So, when you look at somebody who's a perfectionist, why are they a perfectionist? What drives them towards perfectionism? What is it that they feel like they need to be so perfect about? What is the achievement, the end goal? And it often traces back to some of these early roots, right? It was wanting to be perfect for a parent or some other caregiver or mentor that they really looked up to. Or perhaps there was danger in being quote unquote stupid, right? If you did something stupid, maybe something bad would happen. So let's never be stupid and then no bad things will happen. Well, here's the reality is we all make mistakes and we're all human. And well, that's okay. This is how we learn. And can we find a place to be self-compassionate about that? That is really where the healing starts, is finding that self-compassion. We often tend to have compassion for everybody else, but the least amount for ourselves. So I also find in parenting, so this is an interesting piece, is when it's someone really external to us, a friend, for example, that we're able to be a lot less biased with the advice that we give. But often with our children, we almost internalize them. They are a part of us. So we tend to be a little bit harder on our children than we might be on someone else's child. Isn't that interesting? Like, this is where our trauma replays in our parenting. And generational trauma then just repeats itself.
And not just with kids. Something that my wife and I have also found was that once we got married, it was like our partner now represented our childhood family. And all of the burdens that we carry from our childhood then got put on the shoulders of our spouse when we got married. And it wasn't that case when we were dating. It wasn't that case when we were boyfriend, girlfriend. It wasn't that. Something about accepting someone into your most intimate circle. It activates the part, like the last time you experienced that, someone being in that close of a circle. And now it's like there are so many things to work through now that we've gotten married that we didn't even notice, didn't even think was a thing when we were dating or we were boyfriend, girlfriend and all that. It was because these things got activated. I think I want to circle back a little bit to just, I think what you said earlier with taking time to assess your own system, taking time to look at when did this happen or when did this start? What causes it to spike? Like you said, if you go on a school bus and all of a sudden, like your anxiety, or when you think about going on a school bus, your anxiety spikes. And just taking time to look around and say, where is this feeling most heightened? Where does the cortisol spike? All of that. And then maybe that's a good place to start. Let's start breaking that down. And maybe there's someone, depending on where it is, if it's something at school, maybe we can talk to a trusted authority figure there, or an authority figure at home who trusts. Or if you're an adult, maybe you can start looking at, like, is there something about my job? Is there something about my home life, or going to the gym? Like, something about that, and then start looking at that. I wanted to also look at maybe a different area that would highlight some other areas where people should look to start kind of building their own personal roster as a patient. And this one has more to do with chronic fatigue. If someone is dealing with chronic fatigue, this is very different than anxiety, although it might be related. What are the different areas that they might look at to start getting informed about their own system and be able to start bringing the right people in to help them?
That's a great question. So people who have chronic fatigue will often, especially in the pediatric world, will often get referred to a rheumatologist to officially make the diagnosis. But oftentimes they'll also, like PCPs will also do their own initial intake just to make sure that we're not missing anything that's obvious. So as an example, doing a CBC to check for anemia, like a CBC, iron panel, ferritin to check for anemia, because anemia is really easily treatable. So if that's all that it is, phenomenal. That's an easy fix. We get some iron in you and, find a form of iron that sits well with you, because sometimes iron can cause constipation, unfortunately. So not everybody loves it. But when we replete some of the nutrients that we might be missing, that might be good. I tell everybody to go on a multivitamin, like people who are exhibiting uh, chronic fatigue symptoms, mainly because studies have shown that with our current farming practices that we're not getting as many nutrients from the soil that we used to even 50 to 70 years ago. And so we're missing out on magnesium and other basic vitamins and minerals. So again, repleting some of the basics, right? They're called vitamins for a reason. They're vital to our bodies in that they allow us to have these chemical reactions within our bodies to create neurotransmitters or other enzymes to help us. So that's one piece. Again, nutrition. Nutrition is part of it. Exercise and sleep, community, right? If the community stresses you out, well, or the workplace or the school stresses you out, identifying what the stressors are, because sometimes stress by itself, even if it's all internal, is exhausting. Like, people feel very tapped out at the end of the day when they're stressed out. Lastly, I don't want to say lastly, but exercise. People think that when they have chronic fatigue that they're not supposed to exercise, that they're supposed to reserve their energy. Actually, graded exercise, that means working your way up gradually, it can be incredibly helpful because it allows us to build some endurance. It also helps you with confidence, because if you know you can walk a mile without getting utterly floored and exhausted, well, then maybe we can make that trip to the mall, or maybe we can go for a short hike with your child. So there are all these pieces. There are functional medicine providers who are experts at what kind of supplements might be helpful. There are also certain botanicals that could be helpful. Some people like botanicals such as ashwagandha or rhodiola, but I would talk to a physician before starting any of those, simply to make sure that it's the right fit for you. In terms of finding a therapist that can help you cope with what may be a chronic illness, right? I feel like there are some physicians out there, unfortunately, who brush chronic fatigue under the rug as a waste bucket sort of diagnosis. That's a really negative way of putting it. But unfortunately, I feel like a lot of doctors feel like they have no way to help their patient. And so they're like, oh, can't help you. Sorry, goodbye. So finding
And
people in
that
your
again
corner.
goes back to building, the professional needs to build their own referral network, because the more you think about it, like, this is what I do and this is the only thing I do, and it almost blinds you to anything outside of your silo. And it's not just that that's not what I do. It's that it kind of becomes doesn't exist. Like, if I can't fix your problem, then medicine can't fix your problem. And it's like, no, broaden your awareness, get in contact with the people around you, attend networking events or online groups or whatever, and the more you become aware of other people's practices and other people's expertise, it reminds me of a phrase in finance, is the OPM, using other people's money in order to maximize investments and all that, and use other people's expertise, OPE, in order to maximize your clients. Just build that network, build your own awareness. Even if you're not going to be the specialist, at least know someone who does.
I will say too, and this is as an aside, not medical per se, but having a sense of purpose and meaning in life. When we are floating and not feeling attached to anything, when we feel like we lack meaning and purpose in life, it's an energy drainer. But all of a sudden, you give us something that provides us with purpose, or we create purpose, whether it's being able to watch our grandkid graduate from high school or climbing Mount Kilimanjaro. Like, right, you have to have some sort of goal in life to want to really live. And when I say really live, I mean like live vivaciously, live boldly, add color to your life. What are those things that brought you joy when you were little, or when you were a child, when you were a teenager, when you were in college? What are those things that brought you joy? If you have not been doing those things, maybe it's time to bring some of those elements back into your life so that we are now recreating a life for ourselves that is one worth living, one that gives us energy instead of taking our energy.
It reminds me of something that Viktor Frankl, the Auschwitz survivor, talked about, where I'm repeating something that I heard, so if the details are off, forgive me. But basically, he started to note that the prisoners around him were starting to become very despondent, starting to give up hope, and started to essentially fade away. And what he started to do was to walk around to each person that he could and ask them questions about essentially like, who's waiting for you at home? Who is hoping that you'll survive this? What's working on? What project were you working on before you came here that you want to get back to? And just asking those questions of like these things that are outside of this situation that are essentially waiting for you to get through it. And he was just asking people these questions, and he started to note that people who had hope, which is essentially the idea of there's something beyond this situation that I'm working towards. There's something beyond this that I'm going to live for. That will give me the energy to deal with this. The people who had hope could deal with a place like Auschwitz, and the people who didn't would die. And it sounds very much like what you're sharing, where if you have a purpose, essentially it's something bigger, something beyond your current situation that you're working towards, then you can handle anything that comes your way. You can handle any situation that you deal with because you have a reason to deal with it. You have something to work towards, a horizon to work towards beyond the pit that you're in right now.
Right. And I don't want to minimize the effects that something like chronic fatigue syndrome can have, which is that, yeah, you're exhausted all the time. Sometimes your body hurts. Sometimes there is that hopelessness that accompanies it. And we may need to make adjustments to our life in order to accommodate that, right? For many people, when they have kids, they make adjustments to their life so that they can be a parent, so that they can be physically present when they need to be physically present. And if they can't physically be present, they might pull somebody else in to help. Chronic fatigue and any other chronic illness, you may have to do the same. But when we take out the child, right, like sometimes it feels a little harder to garner those resources and utilize them well, right? We almost feel selfish for choosing to work from home, or for saying no to our spouse when they want us to cook dinner, whatever it is. We may feel a little bit guilty about that. And we may have to untrain some of that information that we've been socialized to, that we have to be everything to everyone all the time, always accessible, in order to create healthy boundaries around ourselves so that we can regain the energy that we are not feeling right now.
Or from my own background, that you have to work a 40-hour work week and from 9 to 5 or whatever or more. Otherwise, you're just being lazy. Otherwise, you're a waste of space. And that's something that comes a little bit more from my background, blue collar, working background. But there's definitely that idea. And my wife actually deals with some chronic fatigue syndrome as well as some other things. And so when I got out of the military a few years ago, and then she was in the reserves, we essentially had to restructure our life, restructure our income sources, restructure, and really think outside the box to how do we still live for one, but then how do we pursue our dreams of building best companies and helping people deal with chronic illness, overcome it or overcome trauma, that sort of thing. How do we do all of that while still dealing with our own healing? And I think it goes to what you're saying is that you don't give those things up in order to deal with your own healing. Sometimes those things give you a reason to deal with your healing, the reason to work on yourself. And it's still possible. You have to think outside the box because the box was built by people who didn't deal with what you're dealing with. And you
Mhm.
have to think through and okay, how do I rearrange my life? What schedule do I need to have, or do I need to totally throw out the schedule? In some ways, my wife and my daughter are working through um, ADHD and working on how to reduce the symptoms on that. And things that requires is basically a very unconventional schedule and where it's more focused on their dopamine and when they're able to do difficult things versus when they're not. And for myself, I have to restructure how our house works because I don't have ADHD, but in order for the whole thing not to depend on me, I have to build systems like we talked about earlier so that the house can run even when they're both at a low dopamine level and can't really contribute as much, where I'm not going to kill myself to be able to provide everything. There's ways to do it. You just have to think outside the box and start breaking down the system, as you talked about. Where are the pinch points? What I do here, where are the areas of most frustration? And then what can I do? What changes can I make so that that's easy to do? One example, and this is a little bit going off on a rabbit trail, but one example are the dishes. Dishes are a constant source of frustration because the sink fills up and I don't have the energy to empty the dishwasher, but the sink is full and now I can't cook because I need the dishes in order to do this. Then this is just in the way, all of that. And this is totally a ChatGPT idea that I was brainstorming with ChatGPT and it gave me some ideas. And this is one of them that I honestly didn't believe would help, but it has. And it was simply to put a tub beside the sink. And that tub is where the dirty dishes go. And the sink stays empty. You're still able to use the sink, but then everything, once it's ready, gets just put in the tub. Then you can empty the dishwasher whenever you're ready. And then once the dishwasher's empty, you just put the next load in, press play and go. And then you don't deal with that bottleneck anymore because now your sink isn't full. But that's an example of thinking outside the box. There are ways to still thrive, even though you're still in progress on your healing. If you just kind of break things down and look at the system as a whole.
That is a brilliant ChatGPT example. I'm
I
totally going to
didn't
use
think
that.
it was going to work. Honestly, I had to explain this to me like I'm 5. Why exactly is this going to change anything? But it has. It takes away the mental burden of having to deal with all the crap in the sink because it's not in the sink anymore. I can use the sink and it's not an issue.
Yes.
But simple stuff like that.
Yes. I can't tell you the number of spouses or partners that fight over this. And even myself and my husband just 2 weeks, he tends to be very methodical. I tend to be like the one that's putting out fires constantly. So I might start washing the dishes, but then immediately 5 minutes later, I'm pulled away in another direction by one child or both children or whatever it is. And it gets very frustrating. So having these simple systems put into place where there's mutual agreement, like, okay, this is what we're going to do. We still have to do the dishes, but at least we can do what we need to with the sink to make that happen. Because that was the bottleneck for me, was my dishwasher wasn't empty, so I could not transfer things into the dishwasher. But yeah, perfect.
And doing a change like that, an infrastructural change like that, allows you to do it on your schedule. For my wife and my daughter, that dopamine is really huge. It's very hard to make themselves do anything laborious, anything boring, anything not fun when their dopamine is low. But when they're high, they're able to do it. And so that just basically sets that aside so that when their dopamine is high, they can take care of it and then they move forward. But really kind of I want to wrap up a little bit here because we're coming to the end of our time, but just looking at your whole life, whether you're a professional or whether you're a patient, just taking time to sit back and look at your life kind of as a system, which I think has kind of been a through line for our conversation, and understanding this is all part of an integrated system. This is all part of things that affect each other. This is all part of individual systems that are all part of the same life. The body is a system, or urban planning, and a city is a system. Your house, your family is a system. And learning to look at it that way and learning to look at pinch points, learning to look at bottlenecks and understand, okay, what are the changes that I can make so that I can live the life that gives me hope, that allows me a sense of purpose while still dealing with the reality of today? I mean, what
I
are
couldn't
your,
have summed it up better. I mean, that's exactly it. Yeah, we have to be a little bit meta about it. We have to literally remove ourselves from our body and then step back and take a look at everything and really dig into what's working, what's not working, where we could use help, who we can get that help from, what limiting beliefs we have to, in order to help ourselves. And bringing that all together in a way that's not horribly overwhelming. I
yeah,
mean, you hit the nail on the head is there are so many things that we can change. Are we ready for it? If we're not ready for that change, how do we support ourselves? You know,
there
amazing.
is hope. There is a way forward. You just need to essentially take a step back, look at your life as a system, and then begin tweaking. Give yourself time, be patient, but you will start seeing those little tweaks start to add up and start to lead towards a more sustainable life, a more joy supporting life, and a family and a work life that starts to work better as you look at it and begin to treat it like a system. Whether you're a professional working with integrative medicine or whether you're a parent who's just trying to make sure the house doesn't become a wreck, there's a way forward. Thank
Agreed.
you so much. Thank you so much, Santi, for your time. I love this conversation. I love thinking anything systems, period, but then especially applying it to helping people experience life, experience hope, experience wellness, all of that. I love it. So thank you so much for the expertise that you bring, a really unique perspective, bringing all those different things that you do into this. Want to just let our listeners know, let our viewers know that you own your own podcast. And I think we mentioned that earlier, and the links to that will be in the description. So please go check out Santi. Her wisdom is amazing, as you have seen in this podcast. Thank you, Santi, for coming.
Thank you so much, Brett, for having me. This has been just such a joyful conversation. I have no words. It really touches my heart in a way that I have no words for, is what I was trying to say. When I talk about purpose and meaning, it's this. I found as a general pediatrician that I could not provide this level of communication, this level of support that we are able to outside of that 15-minute examination window. And so that was my purpose is I wanted to be able to help the world in a more meaningful way, in a deeper way, in a way that would allow generations to come to benefit. So thank you so much for allowing me to be part of your podcast, Brett, and for helping to spread the word about that.